22nd, and we're here to keep all of you, our patients, families, neighbors, and friends in the know and up to date on the latest health news in our community. I'm Rachel Lott, Chief Communications Officer, and I am joined, as always, by
JJ Hodshire, President, Chief Executive Officer here at Hillsdale Hospital. And today it is my pleasure to introduce, you've been on before.
I have. It's been a few years.
It has, hasn't it?
Since we were in the boardroom doing
Back
it,
when
right?
we filmed in the boardroom.
Like
That's
a
right.
very long time ago.
That's
so
right.
It was either in between studios or it was before a studio.
It was before a studio.
Okay, like 2020. So that would have been like early COVID.
Early COVID.
Yikes.
So we have Seth Gibson with us today. Seth, as I've just indicated, was with us many years ago. We are excited to introduce Seth today. Seth is really in charge of all of our practices on the outpatient clinics and has done a phenomenal job working in that capacity over the course of how many years now?
5 years in August.
5 years in August. It's amazing. Seth, why don't you just tell us a little bit about yourself and let our viewers know a little bit about the type of work that you do and what's that look like every day?
Certainly. Thank you, JJ. So I'm Seth Gibson, Director of Outpatient Clinics here at Hillsdale Hospital. 5 years. 5 years here with the team, and time flies when you're having fun. That's for sure.
My 5 years is in June because I started
That's
just
right.
barely
That's
before
right.
you. So
That's right.
Yeah.
That's
Wow.
right.
We'll have to have a huge party.
Exactly.
Yeah.
The 5 year
We'll take care of
anniversary.
it.
So. But yes, I have operational oversight over all the hospital and clinics. So anything related to our patient access and care through our clinical teams rolls up through me. And I have a reporting relationship with Mr. Hodshire here. And yes, we work on all of our dynamics together, and we're here to help improve our patient access.
And we're going to talk a little bit today, Seth, about, you got there's a lot of things going on in our clinics. And our clinics isn't just about primary care. We're going to talk about that in just a minute. But, obviously a lot of work ahead of us, but we've done quite a bit in the last few years. And I'm excited about some new changes that are happening. We've implemented some new strategies, and I'm just very excited, Rachel, about sharing with our listeners today what we've been up to. So it's going to be great to have your perspective, Seth, here on the program today.
Thank you for having me.
I think this is our second round of really strategic operational improvements in the clinic since you started, Seth, because I remember when you started, we had this plan that had yet to be implemented and there had been some attempts to implement it.
There were.
And then you came in and we implemented that thing in like 6 to 9 months, and it went very well. So hats off to you on that when you first started. And so now we're kind of into that. What's that next level of improving the care that we have? And access is a huge one. Of course, no one wants to wait very long when you need to see a provider. So let's just start with updates to primary care here in our community. What do patients need to know?
So at our Hillsdale Health and Wellness Clinic and Reading Health Clinic, we have a lot of new faces joining the team. We'll talk more about those specifics a little bit later on here. But with those new faces joining the team, our primary focus is patient access, making sure that our patients are able to get timely appointments, get in for the care that they need. So we're undergoing a lot of changes to implement the improved access, but it's all for the right reasons, to make sure that we're aligning with national benchmarks and we're not just out doing things on our own that we feel is necessary, but to ensure that we are here for the patients for the care that they need.
Yeah. So Seth, I guess the question that I would have for you is, access. And, we often hear, and we had heard for a while that individuals that wanted to get in to see their orthopedic surgeon would often say to me years ago, it's 3 months, JJ. That's unacceptable. And what is a good time frame to get in to see primary care? And then what is a good time frame to get in to see specialty care? Can you talk to us a little bit about that?
Yeah. And we pride ourselves on same day access. And I know, that can be sort of used as a buzz term at times, but when we're talking about primary care, it starts with the schedule of our providers, the schedule of our clinics. And within those schedule modifications that we've made recently, we've been able to change things that are called visit types. So that's the type of encounter that you're scheduled for as a patient. And with those enhancements, we're able to add in extra appointments during a day. We're aligning with industry standards, and those additional appointments increase the access for our patients. So you would see and feel that as the patient by calling into the clinic and looking for that appointment when you're sick or injured or anything like that. So from a primary care standpoint, when we're talking about same day access, hopefully, that's a phone call that comes through. We're able to see you that day. And if not, from primary care standpoint, we are able to fall back on our walk-in clinic for that same day access. We don't want to defer to that necessarily right out of the gate. The goal is for you to see your primary care provider in as timely a fashion as possible. And our walk-in clinic is there to as backup. When it comes to specialty care, as we had mentioned, that
which typically come from referrals, right?
Correct.
I mean, you can self-referral, but most of them come from your primary care referral. So what if I was to go into orthopedic clinic, what should my expectation be?
Yeah, so we have a triage process to make sure that we're seeing you within the correct parameters of time based off your presentation. So if you were hurt and in the emergency room and it was a severe injury, we are going to get you in as quickly as possible, same day, next day, etc. Maybe you're a referral from your primary care physician, you had some imaging done. We'll get that imaging back to make sure we're scheduling you with all the parameters, all the information we need to make your visit successful for your treatment. And we're getting those patients in easily within a week.
Okay. Seth, before we ask any more questions on some follow-up, I do want to get something else on the table and discuss, because there's been a lot of conversation about lately. We divested our work health program. So for those listening today that are thinking, where do I go now? Can you address that?
Yes. Thank you, JJ. That's a good point. And so for occupational medicine needs, if you're looking for a full program, Prompt Care and Coldwater and Well Now and Jackson, those are the two facilities that were somewhat comparable to the services that we offered. Locally, there is a patchwork of sorts with some of the other clinics around that might engage in DOT physicals, things of that nature. But really, if any employers are looking for full-on, robust occupational medicine programming, they will want to defer to those two organizations that I mentioned.
Okay, good. Thank you very much.
And JJ and I, we talked about this, I think, on radio when we talked about the closure of our work health clinic, but we're just in a day and age where there's not as much pre-employment testing. So that makes work health and occupational medicine practices a lot less viable, because there's just not the numbers there of how many people that you're able to serve. Same with injuries, because companies have gotten better and better and better at keeping people safe.
They have.
So it's not like, the child labor factories of the early 1900s, right?
Absolutely not.
So there was a local employer that we had talked to that was a decent size.
Huge.
That basically told you, oh, we had like one injury last year.
Yeah, she literally looked at us. Seth was in my office, and very big corporation. And we said, a facility that you place into our community right now, that you'd place in the other community, given that size, how many injuries would you have a year? And she literally said, was it one or two?
One or two.
Yes. Injuries. And you're like, no, I'm talking about, no, one or two.
Yeah.
And you think, how can you have hundreds of people, 380 people, and only have one or two injuries? There's a lot of new programs for risk mitigation.
Right. They're very good at keeping employees
and safety
safe now.
programs that it's really not there.
Which is great, honestly. You know, but what it does mean is that having a viable occupational medicine location is a lot more difficult in the environment today.
Right.
And so, like Seth said, there still are some of those programs out there. We are not currently offering that anymore.
Yeah.
But if someone gets injured on the job and they need to be seen right away, what is their best option?
That would be through the emergency room if it is a true emergent injury, serious injury. We're here in the ED to still care for those patients and those injuries, and then defer to an outpatient program from there. But again, the Prompt Care and Well Now programs, they can do traditional outpatient occupational medicine visits, should that type of workplace injury be appropriate to be an outpatient type of encounter.
Right.
Okay, so obviously all these changes, let's talk about them, because they have an impact on the type of patient encounter one of our patients could have if they're used to going to someone who's no longer here. And we've had some movement. Individuals have resigned from the organization, and that is well within their rights. People leave all the time. We get people that come into our organization who leave other organizations. People leave our organization, go to other organizations. It's just the nature of healthcare.
Right.
It's rare that you would get someone who's long-term, and we're fortunate we find those people, but we understand that that's not the case anymore. So understanding that we've had some departure, Seth, why don't you talk to us a little bit about what's going on in reading first, I'd like to start there
Sure.
because there's been quite a bit of turnover historically in reading, ranging from when it first started to then. Thank goodness for great partners like Toner Gutowski, who went down there and stabilized that program for us. But there's just been it's what happens in healthcare.
Yes.
They come in, they do their time, they obviously move to other places in the community, or they just move on in general. Tell us what's going on in reading.
Sure. So our current full-time provider at the Reading Health Clinic departs the organization on June 11th. We have a nurse practitioner joining the team by the name of Sherry Gillespie that we are just super, super excited for her to join.
Yeah.
Just her level of clinical acumen and professionalism is outstanding. She comes with a great reputation out of the Coldwater, Quincy area.
But my understanding is she's originally from Jonesville.
That's correct.
Yeah.
Yes.
So she's
Yes.
local. Been in our community,
Yes.
local ties. That's so important, and
that's kind of become our sweet spot with a lot of our new providers,
It
right?
has.
Like Dr. Odell and Dr. Spencer,
Yeah.
Dr. Morgan's from nearby.
You're right. Yeah. It's great to see him come home.
Yes.
Absolutely.
Love
Right.
that.
So this Sherry Gillespie is finishing her time at Coldwater,
That's correct.
and then she's going to start when?
She starts onboarding with us at the beginning of the month in June.
Okay.
And so then by June 12th, after the current provider vacates the position, the very next day, Sherry is seeing patients out at the Reading Health Clinic.
Yeah.
So we call that a seamless transition, and that's what
Yeah.
we aim for. So we already have patients being scheduled on Sherry's template, on her schedule, and she will be getting that onboarding, as I said, to be ready and successful to hit the ground running, so we don't lose sight of our patient access.
Good.
We also have Dr. Kristen Bracklin. She joined the team the end of February, beginning of March. And so she spends some time at the Reading Health Clinic as well. So she's out at Reading 2 or 3 days of the week, Hillsdale Health and Wellness the other days. And that also helps provide that patient access that we've been harping on here. Having that extra provider resource to get the patients in to make sure that we have timely appointments. So
Good.
we're very excited for that access.
So Dr.
Yes.
Bracklin, nurse practitioner now with Sherry Gillespie, and then you got Andy working down there a little bit,
Correct.
but he'll be leaving because he's going back home
Correct.
to Ohio. So there's a little gap there that he's filling for us. And that's a full-time program now with her down there full-time, with Gillespie down there full-time, and then you have Dr. Bracklin in and out of there. Okay. So reading's covered. Transition seamless. Make sure that our patients can schedule it now. Can they do that now?
Yes.
So there's no need to wait if they want to get and see a new provider.
Right.
Those of you who have already been with that provider in the Coldwater area, we'd love to see you in Reading. Please feel free to call Reading, get scheduled. That's something that we want to make sure that we have capacity for you. So please make the call. We'll get you on the schedule. And I'm very excited about that opportunity to bring someone local back home. And what a great community Reading has been for us. Just a great, great facility and great people in the Reading area. All right, so let's transition a little bit. So you got that going on at Reading. At the same time, got some movement elsewhere, and I know you've been doing a lot of recruiting for some primary care. I believe you secured another physician, but talk to us about some of the changes that have happened at HHW.
Yeah, so Hillsdale Health and Wellness, we'll sort of start from the beginning of the year, 2024. We brought on Jennifer Blond as a nurse practitioner. Jennifer started off with walk-in training at our walk-in clinic, and she's transitioning now into seeing more primary care patients. So she's doing an excellent job. We're very grateful to have her on the team. And now she's starting to build her panel. And again, we're tying this back. You're hearing the theme here. We're tying it back to patient access, the need for primary care in our community. So Jennifer's ready and accepting patients from a primary care standpoint. Christina Old, she joined the team as a walk-in only provider in March. And she probably will be taking on primary care duties as she gets settled in and everything like that as well.
Seth, can I interject here? So walk-in versus urgent care versus primary care. Help me understand, when you keep saying walk-in, you're saying same day?
Yes, our walk-in clinic at Hillsdale Health and Wellness, same day access, 10 a.m. to 6 p.m.
Okay.
You don't have to have an appointment.
No appointment needed.
No appointment.
But it's a
necessary.
little different from urgent care, right? What are the differences? Because a lot of larger communities, they have like urgent cares on every other corner.
Right.
And you're like, how do all these places function? But a walk-in is slightly different.
Yeah, a walk-in clinic is a traditional extension of primary care where it's essentially an open schedule for someone to walk in and get the services, especially in the event that they're not connected to a provider, which we will connect you after the fact, after
Certainly.
you see us at the walk-in clinic, or if they are having difficulty accessing their current provider. So an urgent care differs in that it's typically, a place with on-site imaging and, different types of procedures and
So
things
it's
like
kind
that.
of in terms of like the level of care, urgent care is kind of in between walk-in and ER.
Correct.
So what we have with walk-in is really like the same kind of services you would have with primary care, but you're not having to have an appointment. You're just coming in.
Right. And we have providers at the walk-in clinic that are able to do sutures, different things like that,
Right.
which also is something that you hear about in urgent care and everything like that. But again, if it's outside of the capabilities of the clinic, we'll be sure to connect the patient to the ER, call a full report.
Yeah.
Like that.
Yeah.
So suturing, some of those things, but I've got these symptoms. It feels like a cold, the flu, whatever. Stop in. Does it help to call for walk-in, or
No
just
call
doesn't
necessary.
matter? No call
No
necessary.
call
So
necessary.
just stop in.
Yep.
And they'll see you in the order in which you arrive, correct? Unless
Correct.
there's urgency or those type of
Right.
things.
If someone comes in with a significant issue, they may be bumped to the front of the line,
Okay.
so to speak.
All right.
Yeah. And then what about virtual visits? Because virtual
It's
visits can also be sort of like walk-in, right? We have virtual access available.
Yeah, we're doing
Same
most
day?
of our virtual visits through the primary care team.
Okay.
So we had, especially during the height of the pandemic, with all the various restrictions and difficulties, with places in the public being closed down, et cetera. The walk-in clinic did offer more of that virtual touch, which again, it's not that it's not possible now, but
Right.
it's pretty much transitioned mostly back to in-person encounters for the walk-in
And
component.
why do you think that is? Is it just preference of the
It seems to
patient?
be the community's appetite,
Yeah.
as much as anything for that, sinus infection,
Yeah.
whatever it may be to be seen. But again, it's not that we're not open to that if someone were to
Right.
call and have
you do
that
have the
request.
platform still?
Yeah. So they would just, if they wanted, say it's a Saturday, and so they want walk in as opposed to waiting until Monday, because whatever the issue is, they feel like they need to be seen sooner, but they want to do a virtual visit. They just call Hillsdale Health and Wellness and say, hey, can you put me on the walk-in list as a virtual?
We should be able to accommodate
Okay.
it, yes.
All right. Well, HHW, a lot of changes. We had the resignation of Paige Jameson, and we've backfilled that with staffing. But you also have some other great players that are, at HHW that are seeing primary care.
Yeah.
You want to talk a little bit about some of the things that are happening there?
Yeah, similar to the concept we spoke about with Jennifer being on walk-in and then absorbing more primary care duties. Scott Hubinger, he's been with the team multiple years here. Scott is now also taking primary care patients, and he's really transitioned a lot of his clinical hours to the primary care.
Because he was doing almost all walk-in for a while, right?
He was.
Yeah.
And Scott comes with a very strong ER medicine background.
Yeah.
And he's brought a lot to the table in that regard. So Scott's doing an excellent job really building his panel up as well from a primary care standpoint. And we also have Rihanna Pickering, who's been with the team for many years here, and excited to announce from Rihanna's standpoint that she's in the process, very close to or
It's
recently
exciting.
completing
Yeah.
a psychiatric/behavioral health certification, which allows her to more effectively treat our patients that have depression, anxiety, medication management for those types of needs, things of that nature. So we're very excited for her as an individual to complete that, but also to add that into our continuum at Hillsdale Health.
So Seth, talk to us a little bit about how that works. So if I have a child who's struggling, do I talk to my pediatrician first, or can I make just a direct, call there? How should that be approached?
Yeah, there's a couple different avenues. Since Rihanna is a primary care provider herself, if you're already connected, then that is one method that just calling into the clinic, then we can go about it that way. If you are already seeing another provider, such as a pediatrician for primary care needs, that provider can do a direct report themselves.
Yeah.
Or
So-
a direct referral, I'm sorry.
No. So, when we look at that, obviously, when you say the word full continuum, help our listener understand, what does that word mean?
Right. So the continuum of care, it's vast, and we're talking about, from head to toe, type of treatment, right? And any organization, any clinic, of course, there could be certain restrictions or parameters or things of that nature, but our goal is always to be able to do as many things as possible for our patients within reason. So adding this into our continuum, it
Yeah.
makes us more holistic
Yeah.
for our care, for what we can deliver for the primary
Yeah.
care team.
So, okay, we don't have much time left, but I'd be remiss if I didn't mention some of the other specialty services that we offer through the clinics. You have general surgery, you have OBGYN, you have pulmonology, you've got orthopedics. I mean, there's a lot happening right
Yes.
now in those outpatient clinics. You want to touch on any of those? Because I believe we have a new physician here, a new surgeon for general surgery.
Yeah.
Maybe talk about that and a
Yeah.
little bit about what's going on with the
Yeah.
centering. Or
So our surgical group, Dr. Morgan, has been with the team here. Gosh, coming up in August, it'll have been a year. So we're very excited having him. The longevity that he'll bring to the organization and his drive is outstanding. So we're very pleased with him being on the team. Our OBGYN clinic, we are moving to a model known as centering for pregnancy. It's very exciting. It's cutting edge. It's best practice.
There was actually a Facebook last week about it.
Oh, great.
So if you want to tune into that last week's Facebook post, or excuse me, live event, can't call it Facebook anymore, live event, actually had a presentation about the OB centering program. So please check that out.
Yeah, and then just in general, from the standpoint of the rest of our clinics, we are on the fringe of an agreement with a company called Patient Portal, which is an education platform of sorts for our patients. So something that should be happening late summer, early fall at the latest, you will see in our clinics these digital displays, TV screens of sorts that are interactive for our patients, where depending on the clinic you're at, you can receive specific types of education. It also gives us a forum to share information about new providers that have joined the team, new services that we're trying to bring on, because that's always a goal of ours, to enhance that continuum that we spoke about, add new services so we can keep our patients in the community for the services that they need.
So real quick, pulmonology out of Three Meadows.
Yeah.
So Monday through Friday.
Correct.
Great opportunity to schedule there. Call. You can self-schedule, or your physician can schedule you. Talked about OBGYN. Also out there, we got that general surgery. We also have other specialty services that not necessarily that you're over, but that actually complement the care, which we have vascular surgery out there. Dr. Alam, we got Dr. Loganathan. That's going to be neurosurgery. We have ENT with Dr. Mucha, both pediatric and adult. Seth, this is exciting what's happening out at Three Meadows. I mean, when you talk about full continuum, like you just explained, we're taking care of them. When we look at our patient panel, it's really from adolescent, age all the way through, at times, checking into our skilled nursing facility.
Yes.
And we're servicing them in between there. So a lot of progress. If I wanted to find out about providers, do we do that online? What's the best way to find out who's seeing who, what open positions? Rachel, you want to talk
now
about
that?
Now
I'm back. Sorry, I was about to cough
something's
up a
happening.
lung, so I thought, let me just
Thank
leave
you for
the
not
room
doing that.
instead of
I'd be grossed out a little
being
bit.
so disruptive. So I still a lifesaver from HR. So you could go to hillsdalehospital.com/docs, DOCS, to find a provider. You can also go to hillsdalehospital.com/primary care to see a listing of Hillsdale Health and Wellness. Who are all the providers there? Reading, who are the providers there? Seth went over a lot of different providers, a lot of names, a lot of locations. So all that information is available on our website. And then also feel free to call our clinics anytime if you have questions. Our staff would be happy to answer or talk you through anything that you need.
Rachel, so I don't want to, be braggadocious here, right? But at the end of the day, we brought just about every provider and specialty outside of, doing some type of brain surgery or heart surgery.
Right.
But I mean, for a small rural community, you're among colleagues across the country. I mean, I would think that we're pretty much leading.
People are usually surprised when they learn the size of our facility, but they hear all the specialties we have.
Yeah.
They're like, wait, you have neurosurgery, you have vascular,
yeah.
How big are you guys again? They're like, are you huge, but in a rural area? No, we're not. We're a what in Michigan we refer to as a mid-sized vital hospital. That we serve a vital area and a vital role in our community, but we are not teeny tiny and we're not huge. But we do have that full continuum of care, which is nice. Even to the point that, I know people who live in Indiana who come up here to get their care, myself included. But access is a huge thing. Seth was talking about access. Getting in larger communities can take weeks to get an appointment, months to get an appointment sometimes. But here we can usually get you in, like Seth said, pretty quickly within a week if it's specialty, and usually same day or next day if it's primary care. So
it's incredible.
It's
Seth,
pretty
thank
powerful.
you so much for joining us today. Of course, absolutely just doing a phenomenal job out in our clinics. But you have a team. I think you want to maybe highlight. You got a lot of leaders out there that are working as coordinators and managers.
Absolutely. Our team is vast with our responsibilities, and we get a lot done. Again, tying it back to the patient access is why we're here. From the clinic manager, Jessica Lewis, to all of our coordinator teams, team members that are leading each of the clinics on the front lines, to all of our medical office receptionists. Those are the directors of first impression when our patients come in, and it's very important that they help us with that patient access, and our medical assistants and our clinical team and all of our providers that we spoke about today. So that's our full spectrum for the clinic support, and we are happy to serve.
Yeah, absolutely. So great teamwork. If you've not experienced that Hillsdale Hospital touch, please, by all means, check out our Facebook, check out our website, opportunities to see new providers that we're going to be announcing here very soon, and their names. And just so happens the one that we're not giving a name yet, but she's local as well, Seth. Comes from an area of our community. So these are very exciting times for us here at Hillsdale Hospital. None of this is possible. Our growth, the new services we brought here, the specialty services, without you, the patient, using our services. Bottom line, we have to engage with you. We have to provide you the highest level of quality, the lowest cost possible, which is what we do. And we have to ensure that you use our services, but we invite that trust because we give you the quality and the service that you demand and that you need and that we want to give. And so when we look around us and we see 140 plus hospitals that have closed in the last decade, it is very, very disheartening for us to look around locally in a community not too far from us and see them divest their obstetrics program and their GYN program. It's very, very troubling to look not too far from us to see that they closed their psych unit. We're serving those needs right here in Hillsdale, but we invite your trust to use us, for us not to tell that story, for us not to tell the Albion story or the story of hospitals that are closing every week, it seems like anymore, or announcements of bankruptcies every week, or announcement of, takeovers every week, is because you trust us and use our services here at Hillsdale. If for some reason you do not like the service that you receive, you've got to let one of us know. Yes, we want to make those corrections and those changes. And truly, we want to be the provider for you in all of these areas. PET scan, got it. Pain clinic, got it. Women's health, got it. We'll go down the list, which I'm not going to bore you with. But we can service it here. When people tell me, Rachel, will we go out of town for that? Why? You got it in your backyard. Whether it's skilled nursing facility, rehab, whatever it is, we're offering that full continuum. So thank you. Your trust in us means a great deal. And we want to ensure that we have this long-term relationship with you for many years to come, which will sustain this hospital so that we don't tell the story in 10 or 15 years of a hospital that once was. So please consider, if you're not using us, what's keeping you from utilizing Hillsdale Hospital? Has it been a bad experience from 20 years ago? We've changed. Is it a situation that you never, ever took to the patient advocate or ever addressed with anybody? Please take it to us. We want to resolve those things so you can get the services you need in your local community, returning right back to your homes, right back to your workplaces. And it's so convenient, but yet the highest quality as you look around regionally at some of the lowest cost points. So thank you for inviting us into your homes through this podcast, through this Facebook Live, and we're calling it live on everything. But we truly, truly appreciate your trust in our services. And we want to hear from you. If you're looking to join a winning team, look no further. Hillsdale Hospital has plenty of jobs. I think we have 36 now. Last month, I said we had 51. So we've had a decent amount of hires. But if you want to join a winning team, go to our website, hillsdalehospital.com. Under the career tab, you can look and see what positions are open. Some of those entry level that lead to other jobs that we will pay for. We want to invest in you. So if you're looking for a home, if you're looking for a long-term career, look no more. Go to our website, apply for a job, and find that great opportunity right here at Hillsdale. If you're looking for ways to volunteer, we can offer that. We have volunteer services. If you're looking for ways to honor a healthcare hero, go to our website. Look for ways that you can do that as well. We want to engage with you at all of these levels. And we truly, truly thank you for joining us today and for being part of this wonderful healthcare system that we offer, known as Hillsdale Hospital. And until next week, we have a program next week, right?
I think so.
Okay. Stay safe, stay
if not,
healthy.
we'll make sure we do.
Absolutely. And stay Hillsdale strong. And remember, when you place Hillsdale first, we are Hillsdale strong together.